Urinary tract infections are one of the most common bacterial infections in humans. Females are more likely to develop UTIs due to their short urethra and certain behaviors. Urinary tract infection, UTI, is a symptomatic bacterial infection of the urinary tract, including cystitis, urethritis, pyelonephritis, and prostatitis. To treat UTIs, many drugs are used to kill or inhibit the growth of pathogenic organisms. These agents are retained in the renal tubules and are effective antiseptics. Examples of urinary antiseptics include mandelic acid, methenamine mandellate, nitrofurantoin, nalidixic acid, and hexylresorcinol. In this video, we will discuss 4 drugs in detail: Norfloxacin, ciprofloxacin, ofloxacin, and moxifloxacin. These drugs are used to treat UTIs and can be effective in killing or inhibiting the growth of pathogenic organisms. Classification of urinary tract anti-infective agents. They are divided into 2 classes: quinolones and fluoroquinolones. Quinolones are first-generation drugs. It includes nalidixic acid, synoxacin. Fluoroquinolones. It includes second-generation, third-generation, and fourth-generation. Second-generation fluoroquinolones are ciprofloxacin, Norfloxacin, Norfloxacin, and ofloxacin. Third-generation drugs are levofloxacin, sparfloxacin. Fourth-generation fluoroquinolones are gadafloxacin and moxifloxacin. Ciprofloxacin. Ciprofloxacin is a synthetic chemotherapeutic antibiotic of the fluoroquinolone class. Ciprofloxacin is a second-generation fluoroquinolone and works by interfering with the enzymes that cause DNA to rewind after being copied, thus blocking DNA and protein synthesis. It targets bacterial topoisomerase 2 and topoisomerase 4, preventing the bacterial DNA from supercoiling and thus preventing DNA replication. Ciprofloxacin is used to treat a variety of infections, including bones and joints, endocarditis, gastroenteritis, malignant cutis externa, respiratory tract infections, cellulitis, and urinary tract infections. It is also an important part of treatment guidelines issued by major medical societies for serious infections caused by gram-negative bacteria. Ciprofloxacin tablets should be stored at 25 degrees Celsius and come in 3 formulations: tablet, suspension, and solution. Popular brand names include Cipro, Cipro XR, and Proquin XR. Ofloxacin. Ofloxacin is a synthetic chemotherapeutic antibiotic of the fluoroquinolone class. It is a second-generation fluoroquinolone. Ofloxacin works by targeting DNA gyrase and topoisomerase 4 enzymes, which prevents them from supercoiling bacterial DNA. Ofloxacin is used to treat various bacterial infections of the skin, urinary bladder, urinary tract, reproductive organs, and glands. It is available in tablet form and popular brand names include Floxin and Floxin 4. So, if you're looking for an effective antibiotic to treat bacterial infections, ofloxacin may be the right choice for you. Moxifloxacin. Moxifloxacin is a synthetic drug developed by Bayer and marketed in hydrochloride form for oral treatment. Moxifloxacin is a bactericidal, concentration-dependent antibacterial that works by binding to DNA gyrase and topoisomerase 4, essential bacterial enzymes involved in replication, translation, repair, and deoxyribonucleic acid. It is used to treat certain infections caused by bacteria, such as pneumonia skin abdominal infections. It is also used to prevent and treat plague, a serious infection that may be spread on purpose as part of a bioterror attack. Moxifloxacin should be stored between 2 degrees Celsius and 25 degrees Celsius. It is available in a solution formulation and popular brand names include Moxiza and Vigamus. Norfloxacin. Norfloxacin is an antibiotic belonging to the fluoroquinolone class. Norfloxacin is used to treat various infections, including urinary tract infections, prostatitis, gonorrhea. Mechanism of action. Norfloxacin is a fluoroquinolone antibiotic that works by inhibiting bacterial DNA synthesis. It achieves this by targeting the bacterial DNA gyrase enzyme, which is responsible for the supercoiling and maintenance of bacterial DNA structure. By inhibiting this enzyme, norfloxacin prevents bacterial DNA replication and ultimately leads to bacterial cell death. Uses: urinary tract infections. Norfloxacin is commonly used to treat uncomplicated urinary tract infections caused by susceptible bacteria. Prostatitis. Norfloxacin can be used to treat bacterial prostatitis, which is an infection of the prostate gland. Gonorrhea. Norfloxacin is one of the antibiotics used to treat gonorrhea, a sexually transmitted infection caused by Neisseria gonorrhoeae. Traveler's diarrhea. Norfloxacin can be used to treat and prevent traveler's diarrhea, which is a common condition caused by bacterial infection during travel. It's important to note that norfloxacin should only be used to treat bacterial infections and not viral infections such as the common cold or flu. Types of formulation: tablets, oral suspension, eye drops, injectable solution. Brand names of norfloxacin: Noroxin, Chibroxin, Utinor.
Johnson Classes.
The best for best.